Hello, Mrs. Ambassador. First of all, thank you very much for this opportunity and your devoted time for this interview. My topic is about EU4 Health, EU assistance to Eastern Partnership countries during COVID-19. Mrs. Ambassador, on March 26, the European Commission announced the entry into force of the EU4 Health program to support the innovation of EU4 health systems across Europe throughout the period 2021 to 2027. So I would like to know what kind of program is EU4 Health and what are the main objectives of it?
Well, I think we decided that we have to work together really to cope with the general situation, that we have to fight COVID together, but that support is also needed in a broader context. You need a sustainable health system. You need to give the opportunity to the governmental structures, but also to the health sector to develop new strategies, how to cope with these situations, because this overwhelmed everybody. And we are doing this together with the WHO. And it has different consistent elements. For example, we do a lot in awareness raising on the pandemic, but also on the necessity to follow COVID rules, the distance, hand washing, wearing a mask. We supported Armenia considerably with masks, with other medical equipment that was urgently needed ventilators and other things, X-ray machines, and also to, let's say, support Armenia in the field of vaccination, to help to be in this COVAX facility that supports the distribution of vaccines. And we do it together with other European member states. So Team Europe is very important in Armenia. And this is also to be seen via the donation of vaccines over the last months we gave to Armenia in order to increase the vaccination rate.
Obviously, there are healthcare challenges in all over the world, and Armenia is not exception. What are the major healthcare challenges in Armenia and in the Eastern Partnership countries?
Well, I think it is a question of capacity. It is, on one hand, and there we stand ready to also support, let's say, a longer-term cooperation to have a management of health institutions, of hospitals. Yeah, so we are working together with WHO on this, because this we saw it is quite challenging right now when the hospitals are overwhelmed and there are right now not enough beds for people who have to undergo intensive care. So this is, I think, a midterm to long-term endeavor that we do this together. I know that the Ministry of Health is working on universal health care, also to really offer each and every of the citizens the opportunity, and WHO and also the European Union stand ready to consult and to discuss this with the Armenian side. And on a totally different field, we want also to support, let's say, the scientific cooperation, because the question how well trained your doctors are and how much you participate in a scientific work will decide how the health system will be in future. So I'm very proud that we have, via the Horizon 2020, we have one cooperation in the field of medicine. This is a co-brain cooperation together with a German and Swedish university to develop together scientific work on a specific area.
The COVID-19 crisis has significantly affected the Eastern Partnership countries, and since the start of the pandemic, the European Union has provided huge assistance to all Eastern Partnership countries. So I would like to know what actually has the EU done to help the Eastern Partnership countries to tackle the COVID-19?
I think what we did is we were very fast to to adjust to the situation in the understanding that we can only overcome it together. Means we have reallocated financial means, and for Armenia we had a package of 92 million euros, which in one sector is emergency assistance in the health sector, which was, as I said, donation of medical equipment, of masks, of sanitizers, whatever was needed. What we also did is to help vulnerable families, both with hygienic articles, but also with other things they urgently needed, and also to support kids in this period so that they could get a tablet to follow the school. And then naturally, as I said, we worked together to give donations of vaccines and also to facilitate, let's say, the participation of Armenia in the COVAX facility. This is important, this is ongoing. We just had 620,000 doses of Moderna arriving in Armenia, and more will come. It is also depending on the absorption capacity, because these medicines have a deadline, so we have to see that they can be really used. And we will continue to cooperate in this field. Also, awareness raising, I think, remains a very important part of this cooperation. And this we did with all Eastern Partnership countries. And the second element is that we also brought in, we have this emergency mechanism, we brought in medical teams. So we had a team from Lithuania supported by Sweden, we had a team coming from Italy, we had a German team, and they, let's say, they met their colleagues in Armenian hospitals and they discussed very practically how to cope with this difficult situation, both for doctors and for nurses, because these were so much affected by this crisis and were totally overwhelmed. And I think to have an exchange of views is especially important.
Yes. Unfortunately, many of us have experienced and still experiencing mental health problems caused by the COVID-19. What strategies are implemented by the EU to address mental health problems caused by the COVID-19?
Well, I think this is a process which is ongoing, also to really find the scientific explanation. There are different forms. What are the direct mental health problems due to COVID, I think, is still not yet finally decided. So it is an ongoing process to understand the reasons. Let's say what we can offer is to give expertise, but this is a process where we will develop together, because you have long-term problems after COVID. There are people who are heavily affected, and naturally it has an effect also on mental health. And there, the people who had really a very serious form of COVID need to get the support. And in this we will work together with the Armenian government and the scientific world how to tackle this question to overcome these long-term effects.
And my last question, how can we respond to potential future pandemics and counteract it more efficiently?
I think what we learned now, and this is I think the worldwide experience, that we were all overwhelmed. We were not prepared. We had pandemics before, but let's say in this scale, it was new. What we are now supporting is the idea to have a WHO treaty on pandemic preparedness and response. So really that we together feel committed to start to consider preemptive actions before we have a pandemic, and then to set a mechanism of tools that is to be implemented by all countries involved who are willing to go on this path. The European Union is strongly supporting this idea, and there will be a meeting in the second half of November where this question is internationally discussed. and we stand ready to really support the idea to have such a WHO preparedness agreement.
Thank you, Madam Ambassador, for a great conversation. It was a pleasure and honor for me. Thank you.
It was a pleasure, and I hope you stay safe and have a good time. Thank you.
You too. Thank you.